Welcome back. I am Dr. Dan Cooper, chiropractic and a functional medicine physician, husband, father, and semi-pro fun haver. And today I would like to have a little fun talking about a topic that dudes never want to talk about. So the topic is erectile dysfunction. So erectile dysfunction, what does it mean? It means you have difficulty achieving or maintaining an erection. So why does this happen? That is the crux of the matter. Like, why is this happening? And there are two main reasons. So there could be 1,000 reasons, but the two main reasons are one, cardiovascular disease, and two, psychological factors. The cardiovascular disease piece I like talking about because it is kind of a canary in the coal mine in regards to cardiovascular disease, because just like the rest of the tissues in their body, your penis has to be perfused with blood, especially to achieve an erection, because it needs extra blood for that, to fill up the corpus cavernosum and spongiosum, which is what achieves the erect state. So the reality is that if you have narrowed arteries that can't deliver blood, it's difficult to get enough blood into the penis to achieve an erection. So in the same way that having the arteries of your heart clog up with plaque, reducing blood flow to the heart muscle, you have a heart attack. Same story in the penis as well. So from a cardiovascular disease risk standpoint, it could be the kind of thing that you notice, never tell somebody, and so one of these early signs of cardiovascular disease goes unevaluated because you're just too embarrassed to talk to somebody about it, or thought it wasn't important, because you could have just thought it was some fully unrelated thing, so you don't talk to any of your physicians or healthcare partners about it. But I will say it is worth getting checked out for that reason if you experience erectile dysfunction. And does this relate back to things I usually talk about, things like metabolic dysfunction? Sure does, because one of the major reasons for inflammation of vessels is blood sugar dysregulation. Excessive insulin and glucose in the blood is very inflammatory to the vessels. So the way that plaquing happens, so there's a lot of factors that go into, will my arteries plaque or will they not plaque? And in general, there needs to be these circumstances present for plaquing to happen. So we have to have an injurious event to the vessels, particularly the vessel lining. And then you have to have a situation of, at least for wide scale plaquing, you need a situation of hypercoagulability. So what is an injurious event to a vessel? Particularly systemically. Now you could have like an action impact trauma to a vessel and you have vascular damage, which has to be repaired. That repair process, part of that is the plaquing. Plaquing is like a scab for the inside of the vessels. It is a necessary process. When it goes overboard and either plaques too much or for too long and just continues to build, that's when you have your problems with decreased arterial diameter, and so you have less of a hole for blood to go through. So injurious events that are systemic, especially those that are sustained, what's a major one? High blood pressure. So high blood pressure is extra pressure against the walls for every heartbeat. And so when we have that, you have an injurious event. Now you pair that with constriction of the vessels. So in the arterial side of the blood vascular system, you have a muscular layer in that middle layer of the wall. So it can expand to accept the pulse pressure, and then it contracts back down to continue the propulsion of blood along that pathway. So you can have constriction of those vessels that would cause the arteries to be less compliant. So when that pulse pressure hits, the vessel can't stretch as much because it's constricted, which produces more actual impact on the wall. So that injurious event is exacerbated by a constriction of the vessels. Another situation that can cause this lack of compliance is called arteriosclerosis, and that is a hardening of the artery wall. It's not necessarily a contraction of that muscle in the artery wall, but it is a hardening of that artery. And that could be through deposition of calcium into the arteries for various reasons. So moving on from cardiovascular disease. So that is one of those reasons for erectile dysfunction. Canary in the coal mine for your old mindset if you notice, man, I'm starting to develop some erectile dysfunction. Let me take stock of my cardiovascular health. There's your takeaway for that. The other side is the psychological side. So whether it is pressure you're putting on yourself, expectations, whatever the case may be, these psychological pressures that we put on ourselves, they shift your autonomic nervous system from a parasympathetic rest and digest, chill out, repair, recover, feel great side of your nervous system to the sympathetic nervous system. And the sympathetic nervous system is the fight or flight or freeze. It shuts down repair and upkeep because in the context of survival, that's wasted energy, where energy should be shunted to running, jumping, fighting, whatever the emergency action is. And so, interesting thing about erections. So in order to achieve an erection, you need a parasympathetically dominated state. Now to achieve orgasm, that shifts and you actually shift into a sympathetic state to achieve the orgasm. So if you are a chronically stressed person, you are always in this, or at least predominantly in this sympathetic nervous system state, it's going to be hard to achieve an erection. If you achieve an erection and then you start to create some sort of judgment on yourself in the act, or have whatever psychological trigger that is stressful in the act, you will lose the erection because you require that parasympathetic state to maintain the erection. You do whatever testing you do, you've got great cardiovascular health and function. Dang, it's the psychological stuff. And by and large, when I say this to people, I mention these two sides of why you might have erectile dysfunction. And I mention the psychological stuff. If that's what it is for somebody, by and large, they give you that face. You're like, oh, yeah, yep, that's me. And they kind of know, right? Inherently, you know. And so what do you do about it? There's a lot on this topic too. How do I induce a parasympathetic state for one, but how do I peel away those layers of psychological activity that put stress on myself? And that's a whole topic in and of itself. I did just want to highlight it as something you should know, that the things we do inside our head, they have a direct effect on how our nervous system functions. And having specific types of neural activation are necessary for achieving and maintaining an erection. And that is the chill out side of stuff. So unwinding the things you judge yourself for, unwinding these fears that we have, is what these are required steps in having robust and free and effective sexual states and then sexual relationships. So that is what I have to say for today. I just wanted to bring out the reality that the two main causes for erectile dysfunction, cardiovascular disease, and then psychological stressors. If you don't know which one you got, test out the cardiovascular system. There's a number of tests that can be done. Inflammatory markers would be useful. These are things like erythrocyte sedimentation rate, C-reactive protein, homocysteine, stuff like that. And then you can do a stress test. You can do a VO2 max test. There's a number of domains you can hit to evaluate your overall cardiovascular function. And if that comes out clear, hit the psychological stressors and figure yourself out. And if you are one of those people who, as soon as you realize that there's two main sides to erectile dysfunction, and you know you're heavy on that psychological stressor side, maybe just start that work right away while you evaluate the cardiovascular system. I hope this was helpful for you. I do feel it is a very important and essential topic to internalize and understand and put out there, because it's a part of life. And so things that are parts of life should be in the conscious and collective conversation. Hope you guys have a wonderful rest of your day, and I'll see you next time.